Good afternoon. My name is Bill Sederburg, and I am a retiree that moved to the Asheville area 12 years ago. And I got involved in the issue of broadband, and I currently chair a group called WNC Broadband Project. And our commitment is we have a group of individuals that are really committed to getting broadband available to the citizens of the Midwest, I say of the Mid-Mountain area or the Land of Sky Regional Planning area. And we worked diligently on that over the last few years. And as a kickoff, I would say that we're seeing a significant shift from working to get homes and businesses connected to the internet. And we've had some success with that. So the federal government and the state have put in billions of dollars that are now being available to get people wired, get them connected through 5G, generally be available to connect to the internet. But now the issue is shifting from that to what do we do with it and how do we help people that can't afford it. One of the big lessons I learned was that in 1996, the FCC in the nation decided that broadband was a private good, not a public good. And so right now it is all generated by the profit motive, and that if you have an upper income neighborhood that has a considerable number of people in it, lots of companies will want to provide broadband. If you don't have that kind of income, the providers, the ISP, internet service providers, aren't so interested in doing that. But the federal money that's coming in and will be available will help with that a great deal. So the attention is now shifting to usage and helping people without the resources. And today it's very exciting to be joined by Karen Sanders. Karen is heading up a very interesting project which deals with how do you become a digital navigator, how do you help people that otherwise aren't sophisticated in the use of this technology, and then how do you really help people use that to navigate the healthcare system. And Karen, I'm going to shift to you and ask you for your introduction. I discovered earlier that Karen is not related to Colonel Sanders, and she's not related to my friend Aaron Sanders. I don't know who she's related to. Genealogy is one of my interests. We can figure that out. But at any rate, Karen, tell us about yourself, your background, and what you're currently working on.
Thank you, Bill. It's my pleasure to be here. I am a nurse who's been in private practice for 45 years. I'm not in private practice, but a nurse with 45 years experience, and I've been in private practice as an RN patient advocate here in Western North Carolina for the last 7 years. So I have a huge amount of experience across.
And you told me you moved to Asheville
36 years ago.
36 years ago, so you're almost a native.
Almost a
everybody
native.
I run into is within the last 10 years.
And so it's been my great pleasure to go into private practice so I could work with patients and families and give them the health care and answer their questions that they need and want, because our healthcare system is very silo-driven, it's very dysfunctional, it's very technologically difficult to access. And that becomes also important because here in Western North Carolina we have a huge number of geriatric patients over the age of 60, and by 2030, 1 out of every 4 citizens in Western North Carolina is going to be a person who's over the age of 60.
Say that again. So in the year 2030, we're going to have 1 in 4.
1 out of every 4 persons will be over the age of 60.
Now, as I've gotten older, 60 seems young, but I guess that's the age of gerontology.
That is the age.
Oh, that's a little depressing.
And so, and people in these age groups typically have maybe 1 to 2 comorbidities or disease states, and then that requires that they have access to a primary care provider or specialist, or they can access urgent cares or minute clinics, or they can access hospitals. One of the things that's difficult for patients getting their home care is they have to have broadband in order to use their cell phone or a computer. And so one of the things I do is I teach a course at OLLI at UNC, University of North Carolina, Asheville, called Becoming an Informed Consumer Advocate for Your Own Healthcare. And part of that is to understand how do you use your cell phone to access key apps that are going to help you navigate your health.
All right, so this sounds naive, and I am on this, so help me out. So the average person living, let's say, in Candler, okay, has health problems.
Right.
Okay, they probably have a primary care physician,
We
most
hope,
likely.
yes.
Maybe not, but likely. So, and they've been diagnosed with two
Diabetes,
issues, say
yeah, sure.
high blood pressure, low pressure, whatever it is. So how would they interact, you or one of these people that you've trained?
So they might be going to see a primary care physician, or maybe they can't find a primary care physician. They don't know who to call. Or let's say they've had a hospitalization and they've been discharged home and they're totally confused about what they're supposed to be doing with their medications, for example. So people can find me by Googling RN Patient Advocate in Western North Carolina, and I'll pop up. Or you can find me by calling my cell. I'm being referred to by a lot of people.
So 10 years ago, these people were called case managers.
Correct.
In the human services area.
Correct.
Is the general idea is to be a case manager or to train case managers to work with patients and then use the technology to help them?
So case managers have been around, that term's been around for probably around 30 years, and now it's very prevalent not only in hospitals but insurance agencies, companies, and you're assigned usually a case manager to work within the hospital on a nursing floor, for example, or and then if you are discharged home, there is no case manager to follow up with you at home. So that's where our healthcare system has become silo-driven. If you go to the hospital silo, you're taken care of in the hospital, but once you're discharged home, you have to
They're going to wash their hands of you and say you're somebody else's problem.
You have to find someone to help you. So really, I am a nurse with lots of experience, so people will call and say, I'm confused, my doctor is not answering the phone, or I've called 10 times, I'm in a lot of pain.
Do doctors generally know there are people like you that are available to help their patients?
More physicians are learning about this role, and my role is not only for me to be in private practice, but I'm training nurses to do this role to help people navigate the dysfunctional healthcare system. And I work with lots of different physicians as colleagues, and we work together trying to get the patient the right care they need. So I am not replacing physicians. I'm not replacing anyone else. I'm just helping people
navigate the system.
Right, right. Or if a patient doesn't understand what diabetes is, or they've been diagnosed with a high blood sugar count, they will call me and they say they're very confused about these meds, and can I please help them understand what that is? So I will go to a patient home and I access an app called mayoclinic.org. And we all know that the Mayo Clinic in Rochester and Jacksonville and Phoenix, they're the best healthcare organization in the country with the fabulous ratings. And one of those reasons is because they do a fabulous job of a team approach to the patient and teaching the patient about his or her own disease.
Okay, so you're helping these patients navigate this system.
Yes.
Okay.
Yes.
And you need the tools to do that.
Yes.
And so I'm sneakily getting broadband into this.
Yes.
Okay, so
yes.
You go home, and you were telling me before we turned on the camera that you've had some negative experiences in all parts of the area as far as the access to broadband, and then share with us your story about that, and also the challenges of training people to use the technology that might be available.
Absolutely. So I work with elders, people who are over the age of 60, and in this day and time, a lot of them have not had training and understanding what Wi-Fi is, how can the internet help you, what are sites on the internet that are really good for patient education. And then when I go to patient homes all over this region, a lot of them don't have Wi-Fi access. So I had a patient in Cherokee and they don't have broadband access there. I could not access Wi-Fi on my computer, on my cell phone. She certainly couldn't do it. And I said, so how do you get Wi-Fi? And she said we go to the local McDonald's parking lot so we can access broadband so we can get on and do our work, or sometimes we can go to the library, but that's also a problem there for children in school having to access.
So that caused you cognitive dissonance, having a healthcare provider in the parking lot at McDonald's impacting the healthcare system.
Yes, yes.
So what have you found locally? I mean,
so locally it's the same problem. There might be an elder who is living alone. There's huge numbers of elders living alone here in these mountains, and they don't, some of them still just use telephones. Sure. They don't have cell phones, and if they do have a cell phone, they're not schooled a lot on accessing the apps that would be helpful. They don't even know what the word app means.
That's right.
And so there's a huge education opportunity.
Has it improved in the last 5 years, I would say?
I think that with time, more and more people are becoming more educated in that. And it's not only, we have to provide education that is local that people can access. So for example, the Osher Lifelong Learning Institute at Ollie is a fabulous resource for people who are over the age of 60 and can go get classes on technology and using all that. But if you are not able to afford to go to Ollie at UNCA, what about all the other elders here in this community who are low income or can't afford to get that education? So the other challenge is educating our population on how to use computers and phones and accessing.
You run into a lot of challenge of helping people understand what information to trust and what not to trust. I'm thinking about during COVID. I mean, the internet brought us these horse tranquilizers and different, I would say, charlatans trying to sell different.
Correct. Yes. So that's why I keep a lot of apps on my phone that are evidence-based, that use science, and that's interesting that you brought that question up. That I had a patient who was taking ivermectin, and I had a patient who was taking hydroxychloroquine, and he also had some significant lung issues. And so I had to just pull out my phone and show him some studies that showed that this is not a very safe medication for you to be taking when you're infected with COVID. And so what can we do to get you the care that you need with this primary care doctor or going to MAHEC, our Mountain Area Health Education Center?
That's interesting. So I'm intrigued as to where we go from here, okay? And that is, what is your prognosis for helping these individuals as we move ahead 4 or 5 years ago? Do the schools of education, like we've been using UNCA students for our project, and we have some nice videos out there about that. How do we get people educated, and what do we do from a public policy point of view to use the technology and help people? So
I think I want to say that I'm so delighted and proud that you're doing this project with the students at UNCA, and there are other access points that we could be using to train people free, and that would be using churches during the week for UNCA students to come and do in-services on how do you get mayoclinic.org on your phone, or how can I get it on my computer, or where can I get trained on just understanding how to use Gmail. A lot of elders don't have access to email here. So the more that we can create accessible education points, which is not just the university. We also know people go to community college classes, but what else can we do to get people to access those education points? Because if you can learn about how to use your phone and your computer, you can also enhance your health care.
And lots of other aspects of life at the same time. When I was served in the state senate, I was very involved in education policy and really thought that a lot of the decisions were driven by data. I kind of dispelled myself of that later, but I was hired to coordinate a focus group of legislators on what data was helpful in making decisions related to education, not healthcare, but education. And we had a great conversation. And afterwards, a gentleman by the name of Vern Ehlers, who served in the Congress at one point, he was a nuclear physicist, actually, and a really brilliant guy, came up to me and said, "Bill, you don't understand." He says, "I'm disappointed in you." He says, "It isn't just the data, it's who tells you the data, who interprets the data." So I presume it isn't just having access to, mayoclinic.org, but you're a nurse, so you have credibility with talking to these people, that if somebody were to call me up and say, "Hey, I have high blood pressure," I might come up with something, but I wouldn't have the same credibility, fortunately.
Exactly.
So how do you combine the information with the who do you trust?
So I think it would be great to have more nurses involved in this broadband project. That's a very critical thing. It's like, yes, we have the data, but you don't understand the data, so how can we teach you how to interpret that, which will lead to positive health outcomes, where people being more compliant with their heart disease and diabetes, which are huge killers.
Well, it's just so totally confusing. I guess I'm gotten old enough now to hit the confused state. But you watch TV and you see all these commercials for different drugs, and at the bottom they have this little banner that says this will cause your hair to fall out, and you'll lose your right leg, and you'll have suicidal thoughts, and the list goes on and on and on. And you're kind of left saying, "Gee, what's that all about?" And I guess we're only one of two countries in the world that allow that sort of commercials on there. But it's really a tough thing to try and interpret what's effective and what isn't effective.
Absolutely, and that's why we need to offer more courses to our citizens about how do we get this data, or how do we get this information interpreted for me, so I can understand that I shouldn't be drinking Diet Cokes or Cokes and crackers and carbs every day and wonder why my blood glucose levels are so high. And so when we spend time with patients and explain these simple things, and maybe just changing one or two things in your diet can help you a lot.
The nurse is coming out on you.
The nurse is coming out.
The nurse is coming out on you. Yeah, Bill, I look at you and you drink too much Diet Coke. You don't get enough sleep. You have random crazy thoughts and whatever. So I totally understand that. Give us advice. So we don't have all day to talk about this thing, but give us advice as to where do we go with the broadband issue. We're biased here because we're WNC Broadband. But from your experience, and obviously you live in this world, what advice do you give policymakers and volunteers?
I think you need to get in touch with the citizens. And so much in our day and time, we have policymakers that are disconnected to the citizens.
That's right.
Or maybe they are in different political parties and they're not looking at the big picture. But I would say it's really good for policymakers to meet with the citizens, and that would be going to every county. There's 100 counties in North Carolina. That's overwhelming, but can also include the churches and have open forums at churches. That's free. And
that's to educate people about broadband or about medicine?
Both.
Both. You would do both things.
Because all of this wealth of information is there about healthcare, but if they can't get it, if they subscribe to newspapers, and we know newspapers are dropping their circulations a lot because everything is going online.
Right.
So what can we do to help our legislators connect to our citizens and counties and say, can you get the information you need about your health care? What can we do about that?
Just, you might find this fascinating, maybe not, I don't know, but 10 years ago I read a book called The Watchman's Rattle, and it was by a sociobiologist, and she was explaining why we were becoming more and more like clans in our behavior. And what was driving that issue was that the systems had gotten so complex that it used to be that the local employer, you knew who the boss was or the owner was down the street, and if bad times came, you might have people laid off, and you can kind of understand what's going on. But with the internationalization of business and with the complexity of online business and with the internet and everything else, the average person doesn't understand the systemic nature of change in the field. And so as a defense to not understanding the systemic changes and how to interact with the system, we fall back into clan type behavior. And there's interesting variables such as that, such as if something goes wrong, blaming an individual. So we're always hunting for that person to blame, or thinking as a group instead of valuing individual rights and individual thinking. And I'm thinking you're trying to do that. In a way, you're helping people navigate the system by using the technology. Because if you like so many changes have occurred in healthcare, particularly locally. I was just back in where we spent 35 years in Lansing, Michigan, and Sparrow Hospital is there, and that's where our kids were born, and not much has changed at Sparrow Hospital, but I kind of understood how Sparrow operated. That's not true here. There's all sorts of medical changes and providers and whatever. So you're doing a good job, and we appreciate it. And with that, Karen, thanks for your work. And I don't know exactly how we end something like this, but goodbye, everybody.
Thanks
for your interest.